everybody, Dr. Herman, Guru Chiropractor, back again. Peace and love. I'm with my new patient, Jamie. Say hi to everybody out there.
Hi, everybody.
Jamie's a nurse, and she came in today for a checkup and an evaluation, and we're going to do a full body adjustment and a ring dinger, right?
Yes.
You were referred by a friend who I hooked up like about a year ago.
Correct.
And sent you in? Mm-hmm. Okay, cool. So if you don't mind, tell the audience a little bit about like why you're here, what's going on, and what you're hoping I can help you with, and then we'll roll into the exam.
Sure. As stated, I am a nurse. I do a lot of standing. I'm always on a computer with my head down in this type of position. So I have some neck pain, shoulder pain, also some sciatic nerve pain. So that's what brought me in today, to see if there's any way that he can release this pressure and this pain. Well,
thank you, and I'm going to do my very best for you.
Okay.
And if you're like most of my patients, you'll be walking out of here better. I'm not promising perfect, but if I think I can help you after we finish the exam, you should be walking out somewhat better.
Okay, I'm looking forward to it.
All right, so go ahead and lay face down on the table, prone.
Okay.
Relax, put your hands down on the side cushions. And we'll see what's up. Oh, look at this hair. Bring your body down a little bit more so your face is all the way on the paper.
Okay. Braids are okay, straight?
Yeah,
okay.
We'll work around it. You ain't the first. All right, so just stay relaxed. You comfy?
I am.
Okay, I'm going to straighten you out a little bit,
okay,
because I want to see what your posture looks like while you're laying here. So just looking at your posture, just a general posture of eval from laying down. Your shoulders look pretty good. You look pretty square and pretty balanced. But your hips have a torquing to the right. So you got some of this going on. So you're twisted this way and kind of stuck a little bit twisted to the right. I don't know if you have a sense of that, but that's what's going on. The hips are level, so your feet are level, so nothing's pulling up too high. Now I'm going to bend up your knees.
Okay.
When we bend them up, tell me if you have any pressure in your lower back or your hips. When I do this, nothing pulling in the hips or the lower back?
No.
Good, good, good. Come on down. Just feeling the mobility or lack of mobility. And we got a fly coming around. Leave him in the he wants to be in the video. Leave the fly in the video. Okay, as I'm just palpating, I'm feeling that your right sacroiliac is a little bit tighter than your left. Can you feel the difference this compared to this?
Yes.
Yeah. Okay. So let's check again. We're going to do a orthopedic test to evaluate the sacroiliac joint. So I'm going to press down on your tailbone. One at a time. Start with your left leg. Don't bend it. Keep it stiff at the knee. Lift it as high as you can. Go straight up. Yep. High as you can get it. Okay. Pretty good, pretty good. Remember how that feels. Now do the right side. Yeah, see? Okay, we saw it. Right? This one was tighter. It didn't go up nearly as high.
Right.
So that double confirms that your sacroiliac on the right is pretty jammed up. Okay. As I poke in here, is there any soreness or tenderness?
No.
Okay, good. How about out here on this right?
No.
No? Okay, how about on the left?
No.
Nothing? Okay, good. As I come up the spine, I'm feeling, you know, a little abnormal tension, but nothing horrible through this region. But when I get right about here, this is your second complaint. This is the transition area between your neck and shoulders, and we were talking earlier when we did the health history interview off camera. This area is a super, super hot spot, especially nowadays. Forget about COVID. This is epidemic in our society. Too much looking down. Phone, computer. You also have a second job doing catering, so you're always looking down at the whatever you're preparing, right? Stresses the heck out of right here. The good news is I know how to fix it.
Great.
Okay. Now I'm going to check your neck. Okay. Upper neck on the right also is pretty jammed. Is that sore in there?
Not sore, but a little tender.
Do you feel the difference between this side and this side?
I do.
Yeah. That's your C1. That's the atlas bone, or C0, C1 joint, the joint between your skull and the first vertebrae. And it's pretty jammed up on that right side. common symptoms that go along with this are obviously neck pain, but it could also affect your jaw, can contribute to TMJ on that side.
I grind and I clench.
Very possible that this is related to that.
Okay.
Headaches it could cause, which we asked you and you said no on, right? No headaches?
Right, no
headaches. I've seen over the years, it can even cause or contribute to ear problems, like chronic ear infections or just pressure on that side. So anyway, it ain't good and it ain't right, and we're gonna fix it when we get to the adjustment. Okay. So let me write some notes. I'm gonna step out of camera.
Okay.
And then we're gonna come back and we'll talk about what's next. So we got positive knockless. Right. Seems like everything's on the right side for you, Jamie.
Yeah.
We gotta fix that right side, or should we cut it off and put a new one on there?
If this doesn't work, I'm getting a new body.
You better start saving your money. Okay. A little bit tight there, tight there. Okay. Okay, so nothing showed up contraindicative or nothing as far as red flag for safety, so it's completely safe to treat. You definitely have compression here and here, so I definitely feel like I can help you with what I do.
Okay.
So I'm ready when you are. You ready to go?
I'm ready. I'm nervous, but I'm ready.
Okay. Nervous is okay.
Yeah. It's the unknown, but.
Yeah. Not most people, but a high percentage of patients are same thing. All I ask you is, if you get squirrely or anything I'm doing doesn't feel good or right, let me know right away. Verbally tell me, and I'll back off and we'll discuss it. Okay? So there's no reason why you should be all wacky and let me continue on. Stop. Tell me, and we'll talk about it and we'll work it out. Okay? All right. So here's the game plan. I'm going to stretch you out here, just loosen up the muscles a little bit, do a little massage, kind of like a warm up. Okay? And then we're going right into the back room where the ring dinger decompression is. We're going to do a full spine Y-axis decompression pull. You're going to see that's the best thing on the planet for disc problems and pinched nerves from the spine. Non-surgical, best thing on the planet in my opinion. So hopefully that's going to help a lot with your sciatica. But there's other things that jam, that the spine and the joints can jam in other directions other than compressive. So then you're going to lay back down on this table and we're going to finish here with a full body adjustment. Okay?
Okay.
Good. Here we go. Your job, stay relaxed. That's it. And just give me a heads up if you don't feel right.
Okay.
Good. Here we go. Who says goose? Just a stretchy stretch. Okay, come around. Okay, now I'm going to use my mechanical massager called the Thumper. Everybody loves this damn thing. It's a good solid unit. Thumper.com. Tickle or hurt?
Tickle.
I saw you squirm a little bit. If you can't take it, let me know. Tickle, tickle, tickle.
Yeah, it just tickles. It doesn't hurt.
How about this side? Does it tickle on this side?
Yeah.
Alright. Better than hurt, right?
Yeah. Tickles.
Oh. How about up here? Can you handle this?
Yeah.
Alright, let me stay here a little bit because this is really the tight area.
Feels great.
So there's actually a passive stretch that will help with this. If you're interested, I'll teach you it at the end of the treatment.
Okay.
Now, you know, like we talked about, looking down is what causes it, right? So that's flexion. So what fixes it is extension. So basically what you do is you lay on a flat surface and you hang your head off of the edge. Just let gravity have it. It's passive. You don't effort, you just let go, and it really loosens up this whole area.
Okay.
But we'll talk about a few, you know, just there's more details around it that I want you to know before you start doing it. And it only works if you do it. It don't work if you know it and don't do it. I say that tongue-in-cheek because you know how many patients I've told to do stuff over the years that don't do it? You get that on your job?
Yeah.
Non-compliance?
Exactly.
Not everybody. Some patients are really good at that.
Nurses are the worst patients.
Well, like I say, your body, your health, your responsibility, whether you do it or not.
Very true.
My responsibility is to teach you what I think will help you and do my best for you here when you come here. The rest of it's up to you. You getting here, that's up to you. You taking my recommendations, that's up to you. That's you, on the patient. Good. All right, just a nice little warm-up. So when you're ready, come up on your feet, and we're going into the room back behind for the big stuff. Take your time, mind your feet. There's some wires on the floor, and I don't want you to trip. Good. Good. All right, come on through. Don't trip on that little lip there. Give me a second. I want to put paper for your head first.
That's a machine.
Loosens you up already, right? A lot of people say that. They're like, "Damn, doc, I feel good already." Wait, you ain't seen nothing yet, though.
Listen, I watched this video several times. I'm like, I want that.
It's very visual. I find that with people that actually have the compression and feel it in their body, when they see this being done, they're like, I need that.
Yeah, I'm just like,
I need that right
pulling
now.
you from all directions at one time. I'm just like, that's gotta feel amazing when it's done.
You'll see. All right, so come on down when you're ready. Head here, face up.
Okay.
And then we're gonna line you up and pin you in. Yeah, we'll work around that long, beautiful hair of yours. Now, keep your hands up top. Let your legs come straight down. I gotta feel your hips because we gotta line you up. Come down about 2 inches towards your feet. Keep going, keep going, keep going, keep going, keep going, go right there. Perfect. Okay. Now the table's gonna lift up your legs. Let the table do the job. Just try not to wiggle. If this helps you, you're gonna send all your nurse friends over?
Yep.
Uh-oh, look out. Because I know you guys are on your feet, you guys working your butts off.
We give each other chair massages all the time when we're sitting at the desk.
I know how much you guys work over there. All right, so now we're going to pin you in above the iliac crest, above the hip bone. Okay. It's going to be a little snug here, but it shouldn't be too tight. So if it's too much, let me know. I don't want to break a rib or anything. I don't want it to be too tight. Let's put it that way. You good with that? Okay. Good. Now, let me have your hands back behind. This is just prep. I'm pulling out any slack. Make sure you're pinned good. Good. Now feel how that's tight up against the hip? Keep it there. Stay relaxed. Just gotta get my towel ready. Okay. The towel is just because my hand's too small to get the good enough leverage. So we use the towel. Okay, lift up the head. Come on. Let me get this hair back out of the way. Alright, come down. Good. So, it's going to go around your neck, but really it grabs the back of your skull and your jaw like this. But if it's too tight here, it should not be choking you. That's the point I'm trying to say. So if it's too tight, let me know. You good with that? Okay. Your job. Teeth touching together, but don't bite hard. Just keep them touching so when I pull, you don't bang a tooth. Okay. Chin down slightly. You're good like that. And then stay as relaxed as you can. Okay? Are you ready? Yes? All right, give me 5 seconds. I like to say a little prayer and center my head, and then we're going to do it. Stay relaxed. nice and loose. Just getting a grip first. Stay relaxed. Wiggle your left toe.
Oh, God.
Breathe, 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 breathe.
Man.
How was that?
That was awesome.
Was it what you expected?
It was.
All right.
It was so quick, but it was, oh my God.
Listen, I had to be sneaky because the worst thing is if you tighten up right when I'm pulling, it's not good, so I got to be sneaky. You did good. Man. I felt like it went really, really good release on that
I feel it. I feel it down here. It's like.
Is it like a burning now? Like a little warm sensation in there?
Not burning, but it feels, I don't know, like open. It feels loose.
Good. Did you feel it up here too?
I did.
Good.
I did.
Good. Now, I want to do a little more release in your neck before we get you up. Are you ready for that, or you need a few minutes to chill?
I'm okay.
Okay, so we're going to do a little rotation to get out a little more if it needs it. Yep, stay relaxed. Good. Stay relaxed. Beautiful.
Wow, Jesus.
Yep, Jesus. Jesus knows. All right. Much better now. I'm done here. So when you feel ready, come on up. If you need my help, I'm standing right here. You just let me know.
The neck always makes me scared, but that felt great.
I know a lot of people get scared, but it's safe. Trust me, it's safe.
Whew.
Sit up. Good. Now when you get on your feet, just make sure you're stable. And then kind of before you move out of this room, just check your body out and tell us what feels different, if anything. Should be something.
It feels like I'm an inch taller. Woo woo. That feels, it feels good. I can't, it's hard to put it into words.
I get it.
But I can definitely feel, honestly, it feels like I'm an inch or two taller.
Yeah. Well, that's what happens when you don't grow, but if you're...
Decompression is gone.
If you get compressed, literally you could lose a couple inches, but when you decompress, you don't grow, you gain it back from where you should have. So, good! That's good. Everything you said is good indicators of a good release. So come on up on your feet, and we're going to go back on that table, face back down there. We're going to recheck a few things and see what else needs to get done. She's doing good so far, folks. She's doing good. 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 You comfy?
Yes.
All right. So, first I want to look at that posture again. That torque is gone in your hips. I hope the camera can see that. But your hips are nicely leveled and perfect as far as rotation, and they were leveled to begin with. And when I bent it the first time, it didn't pull, right? So I don't have to do that again. So now, we're going to release from back to front. So I'm going to do what's called the drop technique, or the push down. So that you're good right there. So the belly part drops down, which also, by the way, for the people watching and for you, I'm certified to treat through pregnancy. That's why this table drops down like this.
Okay.
You could literally, not you, but a woman could lay all the way through the 3rd trimester on her stomach with this drop down, and I could treat safely and successfully if they need it. Just in case anybody's out there pregnant and having back pain, come on through. Okay, so this pops up, and when I push down on you, it's going to go boom. So I'm going to go boom, 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 boom through the lumbars, and then boom, 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 boom for the sacroiliacs. Stay relaxed. You good? Okay, we're doing more. Woof, that released. Good. Woof. That was crunchy. Not too rough for you?
No.
Okay. Nobody ever accused me of being too gentle, that's for sure. It's moving better here. Can you tell the difference?
I can.
There's a much better mobility. There's not much pushing back at me. That's pretty much, to me, feels like normal sacroiliac mobility now on this side. Yay, that's a good sign. Okay, let's see how the legs go up. So start with the left one again. Keep it stiff. Okay, nice. That was pretty good before. Let's see how this one goes. Go, bring up. Okay, down. To me, it looked like it went up further. Did it feel smoother and easier?
It did. And I feel like I was able to lift it a little bit higher.
Yes, it looked visually too. When you watch your video, you'll see the difference. It went up about a couple more inches higher, so that's great. That means it's released. And usually it's right here pinching that's causing the sciatica. Okay, belly's coming up. Good. Now we're going to go through and do the thoracics and the upper thoracics and the lower neck. So same thing, push down, stay relaxed. Just loose as goose. Good. Loose, loose, loose. Good. Perfect. This is my signature move to release that tight transition area. So look straight up to the sky. A little higher. Now tilt your ear, stretch it, stretch it, stretch it. There, beautiful.
Oh man.
Yeah, you good? Okay, coming around the other side. Look up a little bit, tilt to the left. Good, got it, back in the middle. Nice. So now, it's still a little bit tight, but much better mobility than before. So, good. Now I want you to roll over on your back, face up.
There you go.
You stuck?
Here we
You good, or you still stuck? You want me to help?
There we go.
Got it? Good. All right. Get them beads out of the way.
I know.
Good. All right, now, let me have your hands back behind. We're just going to do a little stretch. Just stretch the shoulders out, and then it's going to stretch the back a little bit too. Good. Relaxed. Boom. Okay, rest them down wherever they're comfortable. You okay getting your toes popped?
Yes.
All right. Stay relaxed. They're not popping, though.
Yeah, not popping.
There's one. Little baby one. Okay.
Interesting.
Now we're going to tug at the ankle to release the ankle. Probably a little at the knee and probably more at the hip. Stay loose. Drop it in my hands. That was good. That was a big one. This one, drop it and flop it. Loose, loose, loose. Good. The pop doesn't mean anything. Sometimes you hear pop, sometimes you don't. Don't get attached that pop means a good adjustment and not a pop is a bad. It's not. It's a byproduct. All right. All good here. All right. Sit up when you're ready if you need my help. I like those nails, by the way.
Thank you.
Swing around, face it this way. So far, what's your general impression so far? You feel looser yet?
Yes. So far, I definitely feel like 10 out of 10. Like I feel so much more relaxed and loose.
Yes.
I don't know. It just
She's wordless, folks.
Yeah,
that's all right. That's fine.
I'm speechless. I'm
She's
sorry.
speechless.
I'm speechless.
No, it's good. It's good. Listen, sometimes I get it. It's hard to put words to.
Yes.
But you feel better, right? You feel good?
I do.
Okay, we can see it in your face. We can see. You look like you're
instantly.
You're like you're blissed out.
It instantly felt better.
Awesome. Okay, we're almost done. All the big stuff is done.
Okay.
I just want to do a little mobilizing of your shoulder joint, elbow, wrist, and fingers, and then we'll be all the way done.
Okay.
Actually, let me just see. Just want to see if. Oh, I wanted.
Occipital.
Yeah. This is still a little jammed up in here. There's a special move that I do to release that. It's pretty powerful. It's called the occipital lift. What I would have to do is stand up behind you, because I got to get way high up, and it's kind of like a scoop. You turn your head this way, and I do a little bit of this, and I release it this way. It's really powerful. It releases the skull from the spine, and you get so much more mobility up there, and it probably will help with the jaw. You down for it?
I'm down.
Okay, good. So what I need you to do is scoot a little bit towards to the edge of the table. Okay. Let your arms just floppy and relaxed. Probably the biggest not
The
problem,
hair.
but the thing is, working around your hair. But we'll get it. Yeah, put it over there.
to the side.
Okay. Give me a second to center myself.
I'm nervous for this move. I just want to put that out there.
Okay.
But
It's okay to be nervous.
yeah, I think nervous but good.
The pull is 10 times more intense than what I'm about to do. So don't worry, you got all the big stuff's done.
Okay.
Okay, so I'm standing up top. Don't push backwards, you knock me off.
Okay.
Stay relaxed. Just turn your head this way. Actually, you know what? I need this to come.
Okay.
Turn this way. Now just tilt your head over my hand. Slouch back into me. You won't knock me over. Just be as loose as you can. Good. There we go. Just got to get that sweet spot. There it is. Perfect.
Oh my God.
Perfect. Open and close your jaw. See if that feels looser.
I mean, I definitely felt the crack. I felt it loosen up as soon as you did it.
Yeah. Who knows how long that was jammed up there?
Gosh.
But let me tell you something. That was a major release. That's going to do some good stuff for you. Turn.
Wow.
Okay. Turn. Good. All right. Perfect. Now scoot back towards me, and we're going to do the shoulders, the elbows, and the wrists.
Okay.
So start on this side. Bend up like that. I got to hug you.
Okay.
Get both hands underneath your elbow, and I'm going to do a little pop-up this way.
Okay.
Loose as a goose. Stay relaxed. Good. Give me this one now. Bend, bend, bend. Elbow down. Relax. Good. Coming around. Nothing too crazy. Just a little mobilizing of the elbow. Good. Elbows are fine. And the wrist. Good. And pull back towards you. Pull. Good. Fingers. You're not too poppy. Relax. Yeah, it went a little bit. Good. All right, relax. Good. That one was loud. Boom, boom. I'll try not to pull your fingernails off.
Oh, they're mine.
They are, folks. I'll confirm. They're her nails. Beautiful. Look. See, wee.
Thank you.
All right, I'm done.
Okay.
You did great.
That was amazing.
Everything went.
You did great.
Thank you. It's an honor to help you. I think this is going to help, but the God's honest truth is I don't know. But all my I have my own measurements to tell whether it's working or not. All my measurements hit 5 stars, so you should be doing better.
I give you a 5 out of 5. I mean, I instantly feel relief. I instantly feel much more relaxed.
Yeah.
So.
Listen,
yeah, like you said, it's hard to put into words.
Honestly, that treatment is still being researched. It's not fully researched yet. I mean, it's been done in the field for 20 years, but as far as real research, they're doing it right now. But a lot of patients comment, like you're saying, after that release, that they feel this like euphoric sort of. I think when you take out all that compression in the spine, the spine, the central nervous system's right there. I think it's like a reboot for the central nervous system.
I felt all the depression leave my body instantly.
Yeah, it's a beautiful thing. And it's probably going to help with your sciatica and all the stress in your back, so it's a win-win all the way around.
Yes.
Great. You did good. Thank you for coming by.
Thank you.
Anything last minute you want to say? Or
no. Come and see him.
If you get sore, ice will be your friend. I would stay away from heat for a couple days, but if soreness, I would put ice on any sore spots. Okay. And if you have any kind of flare-up, it happens once in a while. I'm not going to lie. This is a good time to talk about this. It's not 100% where you get that pull and you go from bad to good and everything goes away like that. That's not how healing happens. Sometimes there's pain involved in the healing process. You work in rehab, don't you?
Yes.
You work post-surgery patients, right? Is that true?
It is very true.
Tell the audience, is that true? Healing hurts sometimes. There's symptoms involved in the healing process.
You're going to feel worse before you're going to feel better.
Sometimes.
You have to go through it.
Sometimes, but that's true. So sometimes people get that pull and a new weird symptom will show up, or they'll get a flare-up before it starts getting better. It's important for people to know that it doesn't just go from, some patients, they go from extreme pain to boom, it's all gone, but that's rare. Usually it's a little up and down process before you completely resolve. Okay? So if anything happens choppy like that and you're concerned, just reach out to my assistant, Zach, let him know, and I'll get on the phone, we'll talk about it. Okay. Usually it's nothing, it's just part of the healing process, but if you're concerned, that's what I'd like you to do. Okay. Okay? All right, so great treatment. I appreciate you trusting me and coming through. Flat surface. The best way to, let's go back in that room if you want to come through. I'll just show you. Come on through. You don't have to lay down. But basically, find a flat surface, relatively firm, not too soft, right?
So like hanging off the bed?
Yeah,
Oh, okay.
As long as the mattress isn't too mushy.
Okay.
Right? You want a little bit of a firmness, and then you just get about this part of your neck, right here. That's where the edge should come to. So you just lay on your back and just get that edge right about there, and just let go of your head. You just let go. It's passive. You don't have to effort. You don't have to push down. You just let go of holding on to it and let gravity have it, right? That's it. But there's a few things. If you go into that position, I already checked you here, so if you start right away, you shouldn't have it, but I don't know what's going to happen to you out in the real world, so I have to give you the contraindications so you know. If you get dizzy when you do that, if you get any kind of nausea, dizziness, sharp pains, feel like you're blacking out or passing out, get up right away.
Right.
You probably know better than the average person because you're a nurse, but don't do it. Those are red flags. Those are no-nos. Get up immediately. Don't do it again until we talk. Okay? You probably will feel some discomfort from the stretch, but that's normal stretching discomfort. That's okay. Right? I would recommend start slow, like maybe only do 1 or 2 minutes the first time you go.
I was just going to ask, like, so how long do you do that?
I'm getting there right away. Start slow and ramp up, but really research shows the window that you want to get into is between 12 and 15 minutes. That's it. Anywhere between 12 and 15 minutes of sustained stretch will get rid of the tension in your neck, but it also help rehab your neck to get it more permanently back up here, which is where you want it. If you're looking down too much, what happens is you get that turtle head, that what's called anterior head, which most people are walking around with some of this right now. If you want to reverse this, rehab, 12 to 15 minutes of sustained hang repetitively over time can reverse that posture. Okay?
What's your opinion on inversion tables? Because I was 2 clicks away from buying one off of Amazon where you straps your ankles in and turn yourself upside down.
Love it for maintenance. I don't have faith that it would fix a sciatica, although some people try to market it for that. I don't have faith that it's going to fix big problems, but in between seeing somebody like me, just to keep the daily stress at a low and keep yourself decompressed, I love it. I would say invest. You don't have to get a $500 one. They have $200, $300 ones. You don't have to get the Mac Daddy unless you want to. But if you're going to use it, get one. But that's the thing. It don't work unless you use it. If you don't use it, you can hang your clothes on and stuff. You can make it a little display, but look what some people do. But yeah, I think it's a great thing to do. If you use it on a regular basis, you will get good benefit from it. So yeah. Any other questions?
No.
All right. So every day is preferable.
Okay.
And consistency is what's going to give you the good results. Ramp up slowly till you get to between that 12 and 15 minute window and stay there. If it gets to a point, if you get there and you do it consistently and it gets to a point where like I'm doing it but it doesn't feel like it's doing anything anymore, right? Roll up a towel, you know, like this or something, and put it under your neck. It'll give you a little more of a fulcrum up, and that'll intensify it.
Okay.
But don't do that right away. Only when you're on the flat surface. If it gets to a point where it don't feel like it's doing anything anymore, then add this on there, and it'll give you a little more stretch.
Okay.
All right. Any other questions?
I think we're good.
Good job. You did great.
Thank you.
Thanks, folks. We'll see you next time.